Today I'm going to present on anatomy of the rectum. The rectum is the final straight portion of the large intestine in some mammals and the gut in others. The human rectum is about 12 cm long and begins at the rectosigmoid junction at the level of the third sacral vertebrae or the sacral promontory, depending upon what definition is used. Its caliber is similar to that of the sigmoid colon at its commencement, but it is dilated near its termination, forming the rectal ampulla. It terminates at the level of the anorectal ring or the dentate line, again depending upon which definition is used. In human, the rectum is followed by the anal canal before the gastrointestinal tract terminates at the anal verge. This is the image of the rectum. This is the position of the rectum in males and females. In males, over the anterior portion, there is rectovesical pouch containing coils of ileum and sigmoid colon, base of the urinary bladder, ampulla of the vas deferens, seminal vesicle, prostatic gland, and the terminal part of the ureter. In female, over the anterior part, there is rectouterine pouch, coils of ileum and sigmoid colon, and the posterior wall of the vagina. Over the posterior and the lateral part in males and female are the same. Over the posterior part, there is muscles, which is the piriformis, levator ani, coccygeus, bones, sacrum, coccyx, vessels, superior rectal artery, median sacral artery, nerves, sympathetic trunk, lower 3 sacral nerve, coccygeal nerve. Laterally, there is levator ani, coccygeus, pararectal fossa. This is the blood supply of the rectum. Anterior supply. Over the anterior supply, there is superior rectal artery, middle rectal artery, inferior rectal artery. It is the continuation of the inferior mesenteric artery. It supplies the rectum and upper half of the anal canal. The middle rectal artery, it arises from the anterior division of the internal iliac artery. The inferior rectal artery, it arises from the internal pudendal artery. Venous drainage is divided into 3: superior rectal vein, middle rectal vein, and the inferior rectal vein. The superior rectal vein continues up as inferior mesenteric vein, which drains into the splenic portal. The middle rectal vein is also known as portal circulation, drains into the internal iliac vein. The inferior rectal vein is also known as systemic circulation, which drains into the internal pudendal vein. Clinical notes: superior, middle, and inferior rectal veins anastomose with each other in submucosa of rectum and anal canal. Hemorrhoids or pulse is the dilation of the veins at the site of anastomosis. Thank you.
Now we are going to tell you about biopharmaceutical process of suppository preparation. In general, drug product undergo systemic absorption through a series of processes. Okay, this is suppositories and this is rectal membrane.
The process includes fusion or disintegration from the dosage form. Second step is transfer of active ingredients into the rectal mucus. Third step is dissolution, then diffusion of active ingredients to the rectal membrane to the systemic circulation. These 3 steps is named as kinetic process, that is liberation or setting the disposition of active ingredients. This whole process involves kinetic absorption to the rectal membrane.
Now, I would like to explain about factors affecting absorption. Factors affecting absorption. There are 2 main factors, which is physiologic factor and physiological related factor, which consist basis and drug chemistry. First, let me explain about physiologic factor which contains colonic content, circulation route and pH. Colonic content. Absorption is better with an empty colon compared with colonic condition like diarrhea or tumor. So, when there is desirable, an evacuant enema may be administered and allowed to act before the administration of a suppository of a drug to be absorbed. To have a clear view, I have shown two pictures inserting of suppository. Picture 1 shows condition of a rectum filled with feces and the second picture shows a condition of rectum with hemorrhoid. These two conditions automatically affects the insertion of suppositoria. Next is circulation pathway. What do you think? Drug or suppository can or can't go through first pass effect? Well, usually suppository doesn't have any first pass effect. This is because the lower hemorrhoidal veins surrounding the colon receive the absorbed drug and initiate its circulation throughout the body bypass the liver. Lymphatic circulation also assists in the absorption of rectally administered drugs. Next is pH. pH of rectal is usually neutral, which is around 7 to 8. pH also will influence drugs released from the bases, drug dissolved in the rectum, and drug absorption. This is because rectal fluid is neutral in pH, so there is no effective buffer capacity. The form in which the drug is administered will not generally be chemically changed by the rectal environment. Next is factor affecting physical chemical properties of drug and bases, which consists lipid water solubility, particle size, nature of bases, and absorption. Lipid water solubility. Coefficient partition of water and lipids, particle size of active ingredients, viscosity of bases. A lipophilic drug that is distributed in a fatty suppository base in low concentration has less of a tendency to escape to the surrounding aqueous fluids than would a hydrophilic substance present in a fatty base, to an extent approaching its saturation. Water-soluble bases, for example, PEG, which dissolves in the anorectal fluids, release for absorption both water-soluble and oil-soluble drugs. Naturally, the more drug a base contains, the more drug will be available for potential absorption. Next is particle size. Smaller particle size is easier the drugs to absorb and the absorption will be maximum. For drugs present in a suppository in the undissolved state, the size of the drug particle will influence its rate of dissolution and its availability for absorption. The smaller the particle size, the more readily the dissolution of the particle and the greater the chance for rapid absorption. Next is nature of bases. Bases should be able to melt and dissolve and release the active ingredients of the drug. What will happen if there is interaction between drug and bases which inhibits the drug release? And how if the basis irritates the mucous membrane? The possibility of chemical and or physical interactions between the medicinal agent and the suppository base which could affect the stability or the bioavailability of the drug. If the base is irritating to the mucous membranes of the rectum, it may irritate a colonic response and prompt a bowel movement, negating the prospect of completing drug release and absorption.
Hello there. Today, I'll be talking about the biopharmaceutical evaluation of the rectal preparation. The points that I would like to discuss in this topic will be the melting point of base, which is the lipid base, the rate of melting of lipid base, the rate of solubility of water base, viscosity, and dissolution. Before I further elaborate on all these points, let me tell you the key point and the most important aspect that we need to look into in the evaluation of biopharmaceutic or fractal preparation, which is it must always be in solid form in room temperature but must immediately melt and dissolve in body temperature till the medicine contained in it must be fully released once being used. Now, let's look into the first point where the melting point of the base, which is of the lipid base. The melting point must always be in the range of 30 degrees Celsius to 36 degrees Celsius. It melts in rectal temperature, and when in room temperature, it's yellowish to white in color, in solid form, and has the aroma of chocolate. Now, let's look into the second point, which is the rate of solubility of base, which is of water soluble base. Now, when we see in this particular graph, we can see that there is two commonly used water soluble base, which is the gelatin triglycerinase base. And let's talk about gelatin triglycerinase base first of all. It is hygroscopic, which is it easily evaporates, and it is lower in rate compared to oleum cacao. Why? Because the texture of gelatin triglycerinase base is very soft, and due to its texture, it is commonly used as suppositoria for the vagina and urethra. Now let's look into polyethylene glycol base. Polyethylene glycol base is made up of polymer from the ethylene oxide and water. The most commonly used PEG will be the PEG 200, 400, 600, 1000, PEG 1500, PEG 1540, PEG 3350, PEG 4000, PEG 6000 and PEG 8000. The numbers actually show the average molecular weight of its own respective PEG. PEG base usually will be mixed with a method of melting by using two different types of PEG or more in order to get the base of suppositoria with the best consistency and characteristic that is needed. And PEG, when we use, it is always has the release which is slower in rate, and we also found out that the melting point is higher than the body temperature. So what we can see here is when we use PEG base, we do not need to put it in refrigerator. Why? Because it doesn't melt in body temperature. So once it is being inserted, it slowly gets dissolved in our body fluid. Now let's look into the next factor, which is the viscosity. The viscosity, when it is not enough, can cause the component from the mixture to form sediment. It can also affect the integrity of the final product. How about dissolution? Dissolution actually has few factors that influences it from the rectal drug preparation, such as the surfactant, solubility, viscosity, particle size of the active compound, where the smaller the particle size of the active compound, the higher is the dissolution rate.
Journal review. Journal that we picked to review is Formulation and Evaluation of Lonazepam Suppositories. This journal is about formulation to create new preparation, which is lonazepam in suppository preparation. This journal is to show and compare the base that's suitable for use with lonazepam. Background. The aim of this journal is to determine the formulation of lonazepam suppositories, to determine the best result evaluation of lonazepam suppository base, to show the ability when absorption and liberation process, to know which are the suitable base that can use for lonazepam, such as agar base, cocoa butter base, or polyethylene glycol base, and to know the best result of base for dissolution rate to use in rectal preparation. It is important to know the dissolution rate to make sure the preparation melt or dissolve and remain instant with the appropriate period. First of all is what is suppositories. Suppositories is a solid dosage forms intended for insertion into body where dissolve and exert local or systemic effect. The shape and size of suppository must be such that it can be easily inserted into the intended orifice without causing undue distension. Introduction for Lonazepam. Lonazepam is a new NSAID drug of the oxycodone class. It has analgesic, anti-inflammatory, and antipyretic properties. Its indication is for treatment of acute mild to moderate pain, as well as pain and inflammation of the joints caused by certain types of rheumatic disease. Mechanism of action of lonazepam is inhibitory action on the prostaglandin and thromboxane synthesis through the inhibition of both COX-1 and COX-2. Lonazepam eliminated by liver. Rectal drug delivery has a number of advantages. It can reduce hepatic first pass elimination of high clearance drugs. It can improve enzymatic drug stability, higher drug load, and most importantly is avoidance of gastric irritation. The base that used in this journal is polyethylene glycol, agar base, and cocoa butter. PEG is dissolved in the anorectal fluids, released for absorption both water-soluble and oil-soluble drugs. Various combinations of these PEGs may be combined by fusion using two or more of the various types to achieve a suppository base of the desired consistency and characteristics. PEG suppositories do not melt at body temperature but rather dissolve slowly in the body fluids. For agar, it used with glyceryl bihinate as a control release. For cocoa butter, it melts between 30 to 36 degrees Celsius and exhibit marked polymorphism. Used at beeswax as a sustained release. This is the table formulation of lonazepam suppositories that has been used in this journal. This is example of agar base and PEG cocoa butter formulation codes.
Hello, I will be presenting about the results and discussion as well as the conclusion. This is the table that shows the evaluation of suppositories for various parameters. As you can see, all the prepared suppositories showed uniformity of drug content, which is within the permissible range, which is 95 to 100%, indicating uniformity of drug dispersion in the suppositories. The weight variation study of all suppositories were found to be within the acceptable range, which is less than 5%, as well as the hardness of all the suppositories show a good strength of range of 1.5 to 2.5 kilograms per centimeter square, showing optimum hardness. This is the in vitro drug release data, which you can see the PEG suppositories give a good drug release, followed by agar base suppositories and cocoa butter suppositories. And figure 1 shows the percent of drug release over time for agar base suppositories. Figure 2 shows the percent of drug release over time for PEG base suppositories, as figure 3 shows the drug release over time for cocoa butter based suppositories. This table shows the drug release for the kinetic study of all the suppositories. Discussion. The overall release of lorazepam from different bases was as follows. The highest, which is PEG, followed by agar and cocoa butter suppositories. From the dissolution study, it shows that the agar-based suppositories do not disintegrate, melt, or dissolve in the dissolution medium but remains intact. In agar-based formulation, the addition of HPMC K4M and E15 as well as glycerol bahenite retard the release significantly due to the increase of viscosity and gel strength of the polymer matrix. This causes the drug to take a longer time to diffuse from the matrix into the dissolution media. The drug release from the PEG suppositories as a consequence of a progressive dissolution of PEG in the dissolution media. Slow release of noroxicam from the cocoa butter base was due to high lipophilicity of the base, non-miscibility of the base with the dissolution media, and the absence of additive or surface active agents. Agar-based suppositories show drug release by Pepper's kinetic model, whereas cocoa butter shows drug release by Higuchi and Pepper's model, and PEG shows drug release by Higuchi, first order, and Pepper's model. Stability studies show no significant change in drug content, physical character, and dissolution profile of the suppositories after storing them 6 weeks at refrigeration and room temperature. The conclusion for this journal is suppositories can be prepared by utilizing both hydrophobic and hydrophilic bases such as PEG with high molecular weight and low molecular weight in different percentage. Cocoa butter based suppositories for very slow drug release, and agar based with addition of HPMC, glycerol bahenite show sustained release suppositories. Agar suppositories show drug release by Pepper's kinetic model. Cocoa butter shows drug release by Higuchi and Pepper's model, and PEG shows drug release by Higuchi, first order, and Pepper's model. Refrigeration storage is better than room temperature for noroxicam suppository storage. That's all. Thank you.